Hi, my name is Dr. Erwin Kwan. I am on a mission to dissect what makes high performers, innovators, and great leaders successful. For this podcast, I aim to share insights from interesting and exciting conversations with people who have figured it out to inspire you and empower you with actionable tips you can put into practice to hopefully improve your life.
This episode is part 2 of my conversation with Dr. Mahibur Rahman. He's a portfolio GP, consultant in medical education, and medical director of eMedica. We cover a lot of ground in this interview. In the last episode, I asked Dr. Rahman how he started his career in medical education. He shared his experience as medical director of eMedica and how he worked in parallel as a GP partner. If you have not listened to the last episode, I recommend you go and listen to part 1 first, as you will learn insider knowledge how Dr. Rahman turned his passion for teaching into a successful career in medical education. We talk about the importance of preparation and organization to be an effective practitioner. In this episode, we dive into common pitfalls to avoid as a portfolio GP. I asked him how he maintains a healthy and balanced lifestyle. I asked him to share how he overcame what seemed to be a crisis during his training and what he learned from the setback. I want to ask you next question about your speaking engagement because you've been more involved in speaking to different audiences in the last few years.
I've been teaching with eMedica since sort of 2005 is when we ran our first course. Before that, in 2004, we started developing the website, but we didn't run the first course till 2005. I think from that, and just having been involved and teaching lots of trainees, often they would feed back to their trainers or their program directors that they found this session really helpful. So as a result of that, often it would lead to an invitation. So I taught at the West Midlands Deanery Leavers Conference for many years about portfolio careers. Um, I, I was invited by some of the faculties in London to go and teach about CSA. I was invited to train a group of trainers by the Deanery about how to give constructive but critical feedback and help people who are struggling with CSA. But also organizations like the Medical Protection Society. I've taught at their national conference about CPD, the importance of keeping up to date, about e-learning as part of that. I've taught students applying for medicine about the pathways and options to sort of thrive in medicine, the different career pathways there. I teach at a summer school, for example, at Concord College. And then things like Doctors Worldwide. I've been involved in humanitarian medicine for many years, but they run a training course on sort of humanitarian medicine and global medicine. And so last year, or it might have been earlier this year, I was invited to teach a session about my experiences in humanitarian medicine and about how people could get involved. And I'm going to be going out later this year to teach a program to local doctors in Bangladesh to try and develop some skills so that we can leave a lasting impact, hopefully, in terms of long-term upskilling some of the junior doctors there. So I think it's one of those things that often if you teach at an event, there might be some people there who are planning their own events. So I think after I taught about portfolio careers at one place, I got invited to teach about portfolio careers at several other places. I then someone that came to one of our courses wanted to run a podcast, a webinar on portfolio careers. So they asked me to be involved in one of those. So often what happens is there'll be someone in the audience that then is planning another event, and it sort of snowballs. One speaking engagement leads to another.
When you have so many speaking engagement, then it can be difficult to actually having to refuse some of them.
Yeah, that's actually a great point, that when you've got a lot on your plate already, it's really important skill to be able to say no nicely. Because otherwise, if you're doing something and you're passionate about it and people can see that, often lots of people will ask you. And if you said yes to everything, you'd end up that you'd have no time for everything else that you need to do. So that's actually a really good point. And I think one of the things that I found really powerful is I read this article, and it stuck with me, is just to remember that every time you say yes to something, you're saying no to something else, and vice versa. I.e., if I say yes to a particular speaking engagement, if it's one that involves me traveling, away from my base, and by the time I finish speaking there and I travel back, I might be saying no to seeing my kids that evening before they go to bed, because I might not get home till very late. And sometimes you do that, but that I'll have to turn a lot of engagements down so that I'm not continuously missing the dinner, which we like to have dinner as a family in the evening, or because I'm already away a lot. We teach courses all up and down the country, so I'm already traveling a lot, and then I have to be in Manchester examining for the GMC several times a year. So again, I'm going to miss those. So I have to be careful what I say yes to, because every time you say yes to something extra, you're saying no to some time for yourself, no to some time with your family, no to something else that you could do with that time. So that's a great question. It's a really important thing to pick and choose what you take on.
Yeah, that's very interesting you mentioned that, because when you say yes, then you're actually trading off something else, and we forget that we're sacrificing something, and we end up juggling so many things, and we're not actually doing any favor to ourselves.
Yeah, definitely. I think that it's important to remember that, especially if you get in the position where you're recognized as being good at something, often more and more people ask you to do it. More and more people will ask you to do something, and so I think that is very important, that you goes back to that planning and being aware that you've got needs yourself. You need time to rest, you need time to exercise or to eat well. That might mean that you need time to cook, for example. You need time to pursue hobbies and interests outside of medicine. You need time for your family. And so, yeah, the more you take on, the more things you're having to give up. And so you've got to balance that.
What are common mistakes you see doctors make when developing a portfolio career?
I think perhaps the biggest mistake that sometimes people would make when thinking about portfolio career is that sometimes people think, oh, I'll do this because it's going to bring me extra money. And I think that that's the wrong way to look at portfolio careers, because the vast majority of additional roles that someone could do, for example, most of the portfolio things I do outside of core general practice, they pay the same or less than just doing some additional sessions as a locum GP. And so what I would say is that if you're thinking about taking on an additional role, do it because it's something that you think is going to be stimulating for you, because you're interested in it or you're passionate about it, not because you think it's going to make you lots of money, because most portfolio roles don't. A few of them, after many years, if you get to a very high level of expertise, they can be very lucrative, but the majority of additional roles, they will pay less than or the same as doing regular GP work. So if you do something that you don't really like and you're not really interested, engaged, and passionate about, and then you find you're getting less money, especially once you factor in time that you might take to do courses or get additional training and to keep up to date in these extra things, all you're going to do is make yourself miserable. You might as well just do an additional session. Instead, if you're interested in something, that's a good reason to develop an additional role in it, because you're interested in it. And then you might find that the money follows later. It might not, but if it doesn't, the fact that you're enjoying it and you're just doing something different. I'll give you a good example. During my GP training, I did musculoskeletal medicine. And before GP training, I actually worked in orthopedics for quite a long time. And one of the skills that I still use today is joint injections. And I really enjoy when, I do some joint injection in clinic, because it's different to, seeing my other GP patients, in that I'm getting to do something a bit more practical, and it's really satisfying. Okay. And now I don't have a joint injection to do in every clinic, but it is nice. Now, if someone was to think, okay, I'm going to develop that skill and go on a course and maybe practice with someone unpaid to develop that skill, and then they go to a practice and say, look, all right, I'm going to do a whole lot of joint injections for you. Well, they might not have enough joint injections to fill a session, but even if they did, they're probably not going to pay you any more than if you were just seeing patients, doing routine GP work. Whereas if you did that because you think, it's really nice to do something a little bit different, it breaks up my session and I enjoy doing that, I enjoy using that skill that I already had or that I've developed, then you don't mind that. It's just, it's another thing that's part of my working week that I enjoy. I make no more money doing joint injections than, seeing patients in clinic, but it's something that you enjoy. Similarly, if I look at my clinical portfolio, so, I'm a part-time partner in a practice. There's two of us, a very small practice. I do some community detox work. So, patients who are coming off opioids, sometimes they're coming off alcohol. That's probably the biggest part of our work, but also, patients coming off cocaine, heroin. I've worked as a prison GP. You mentioned earlier, I've done medicals at an army base. I do some work in an inner city practice, often covering when the main partner, who's a very good friend for many years, when he's on holiday somewhere, I might cover him. I do a clinic once every other week as a GP at a unit for women with very severe mental health problems. Most of them are sectioned, so they've got a psychiatric team that looks after their mental health issues, but of course they've got often a lot of physical health, because when they're very unwell they might neglect themselves. And so myself and my partner, we take it in turns. Basically, we're the resident GPs for that practice. Okay, now pretty much all of these roles, they pay about the same. Some of them actually pay slightly less, but I do it because it's interesting. Okay, so for example, if I go and do medicals at an army base, it probably pays less than just doing a locum in another NHS practice. However, it's interesting work. It's in a different setting. I enjoy it. Okay, so I think that's the one thing I'd say. If you're going to develop a portfolio career, add additional roles that you find stimulating, that you find enjoyable, that you find exciting. Don't do it for the money.
I think this is great insight. Thank you for sharing that, because portfolio is something that's very personal, and if you're going to do this for a long time in your career, I think it's very wise to choose something that you'll enjoy.
Absolutely.
It seemed to be a recurrent theme where you like a variety, and I suppose that's probably why you went into general practice. How do you see your career develop further? What do you want to do?
So it's really interesting that a lot of the things that I've ended up doing, they weren't by design. They're things that just I was at the right place at the right time, if you like. So, for example, I mentioned earlier that I've done some medicals for the army when they're recruiting people to start officer training, and that came about because one of my very good friends used to work part-time as a taxi driver while he was finishing his studies. He is a computer science graduate, and he happened to pick up a guy who runs an agency that specializes in prison locums and medical locums for the military bases. And he happened to start talking to him. So, my friend's a GP, and he used to be in the cadets, and that's how that came about. It's also one of the ways I got interested in doing some prison work, is then through that agency. So it's just one of those things that right place, right time. Similarly with things like getting involved with writing those questions, just one of those things that I saw an advert about it, and I thought it happened to be a couple of days that I was free when they were doing training down in London, and my mum lives in London, so I thought, I'll go down, do this training, I can visit my mum, and I really enjoyed the training, and then I had to write some sample questions, and then you go to the peer review, and then sort of I've become an author now. So sometimes these things just happen, that you'll meet someone, or you'll be at an event, or you'll see something, and it just is serendipity. It's the right thing for you at that time. Other things might be more by design. So, I've always had this passion for teaching and medical education. And so I actively looked for things to get involved in that. So going forward, I think, I love my medical education work. This practice that we opened a couple of years ago, myself and a friend I was at medical school with, we'd always talked about doing something. Um, to be honest, we're both already working full time, so it was a big thing to take on board. And between us, we're both part time in the practice, and then doing other things. We're managing it. So I think over the next few years, I will probably be spending more time on that clinical role as we start developing that practice further. And so I will probably have to cut back some of my additional roles. So I think I'll keep my main medical education roles, and then that clinical role will probably grow. But maybe some of my additional clinical roles, like the prison work, I might have to drop so that I have time for everything else in my life.
You like to spend time with your family, and it's one of your priorities to make sure that you're here for your children. And you also mentioned about you like cooking as well. Could you tell us more about your hobbies?
Yeah, so I mentioned earlier when I was in medical school, I worked as a waiter for sort of about 4 years. I used to work every weekend the first 3.5 years, and then the last sort of final year, I didn't really do much work. But in the fourth year, I worked some weekends, and some weekends, there was a lot more clinical rotations. I was away from Cardiff quite a lot, doing different rotations, different parts of the country, and so I worked actually in the front. So working as a waiter, but I'd always go into the back and see what the chefs were doing, and I just got really interested. And when I actually used to live on top of the restaurant with some of the other staff, so often we'd come down in the day and we'd cook up different things, and it was really, I started getting interested then. But it was after I left the restaurant and started living on my own, or living with a friend. He was a really great cook, and then I started learning different recipes from him. And then when I got more interested, and whenever I came home, I'd see what my mum was doing. My mum's a fantastic cook, and so it just started growing from there. And then, I mean, the other side of it is that I've always liked eating. So whenever I go to a different restaurants, I love to see what's there and try different things. And I've been fortunate enough to travel to a lot of different countries. I love to see new places and try new things. And so whenever I can, I do try to do some cooking, but it can be difficult when you're busy. And I think especially when I'm away, staying overnight at a hotel because I'm teaching a course in a different city, that's one of the things I miss the most, is home cooked food. Is that having a takeout or restaurant food, you don't have that same level of control.
I have so many questions actually about what you want, about what you just described. But I want to know what restaurant was it?
It was a restaurant called Jubaraj in Cardiff, in Rubaina. They've actually got quite a few now in Cardiff, and also one in Swansea and Newport. But the Rubaina one was the original one, and it's got a fantastic reputation as one of the best restaurants in Cardiff.
Right. And as a doctor, I suppose it can be very difficult to actually take time and cook food. What would you advise fellow doctors to do?
So I mean, there's quite a lot of tricks that I learned, both from seeing what the chefs would do in the restaurant, but also just being busy but still wanting to have fresh cooked food whenever we can. And especially with the kids, we don't like to give them processed food, so we like to make sure we've cooked from fresh whenever we can. So a couple of tricks. One thing that you can do is, often at the beginning of the week, I would marinate a whole tray of chicken and just sort of cook it off in the oven so that it's basically cooked through, but it's just got like a mild marinade, like a base flavor, so that the kids, we can make them something simple from that. And then this is what they'll often do in restaurants, is that they'll have a base flavor, and then you can make lots of different dishes by then, frying off some onions, garlic, putting different spices, adding in whatever additional thing you want. And then you take that chicken, which is already cooked, and you add it in, and then you might be able to cook up something fresh in 15-20 minutes, and it'll have a really nice flavor. And that chicken would then sit in the fridge and last 3 or 4 days, so you're not having to cook that from fresh every day.
That's brilliant. I love the fact that you're using planning and batching to make sure that this help you.
Well, I was going to say the other thing that can be quite useful is my wife is very organized. So, if you plan your shopping in advance, and then you can get a delivery, and that can also save time. So Tesco will come and deliver, and if you know what you want to eat on different days in the week, you know you can plan around those things, and then combine that with things that are already, if you like, frozen and pre-done but fresh cooked previously. That can be quite a good one. There are some things that are quite time intensive. So, for example, cooking a curry from scratch, can take an hour, an hour plus. But if you cook, if there's the four of us, we'll cook enough for 12, so you can freeze two portions for another day. And some days you come back, you're really tired. My wife's also busy, she's tired, but we can just defrost that and it's fresh, and then just make up a fresh salad or something like that, and fresh rice. Again, you've got a healthy, nutritious meal, but some of it was just frozen from when you previous, because cooking a curry for 12 doesn't take any longer than cooking a curry for 4. It takes about the same amount of time.
I want to ask you now, have you dealt with what seemed to be a crisis or failure at the time, which later turned out to be a blessing in disguise?
Yes, actually, that's a great question. So when I sat what was called summative assessment. So actually, when I did GP training, MRC GP was optional. Unlike you guys, probably you're training yourself, Erwin, and those other registrars listening, you have to sit MRC GP, right? It's mandatory. So when we trained, the mandatory exam was called summative assessment, and MRC GP was actually optional. And so probably half of our cohort sat it. A lot of us didn't sit it. And I actually wasn't going to sit it initially, but then my trainer sort of encouraged me, said that you might as well do it. It might be useful later on. So I started doing it, and I came to it quite late. And in those days, there was no CSA. The communication and consultation skills were assessed by you filming videos of real life patients with consent, and you submit that tape to the Royal College, and it would be analysed. And I sent off my tape, and I passed summative assessment. So I was going to be finishing my training soon, but for membership purposes, I used the same videotape, and I failed that, and I failed by 1 mark, because they said that the level of the challenge in the consultations that I sent off, they weren't any really challenging diagnoses or challenging consultations. Now, the thing is, unlike the CSA, where there are some cases that are straightforward, some that are quite complex, and some that are in the middle, the level of challenge is set by the exam, if you like. With video, one of the difficulties is that if patient says that they don't want to be recorded, you can't record them, of course. You need consent. And so a lot of patients in the practice I happened to be working at, they just wouldn't give consent. So I was limited to, and because I hadn't decided to do membership until very late, I didn't have much time. And, we didn't record every time because to set up all the equipment and so on. And so, I had to make do with the videos that I had, basically. In that couple of months, there just didn't happen to be things that were difficult and that the patient would agree to. And there were also rules like the examination couldn't be on camera. You had to do the examination off camera. And sometimes, patients would take off their top in front of the camera as you were taken to the couch before you'd ask them to. And, things like that. You couldn't submit that consultation then because the patient had been shown, with their top off, for example. And so, I was quite upset that and disappointed that I'd failed. But it turned out to be a huge blessing in disguise, because I then finished training, having not got MRCGP. I then had the choice, because CSA was just being introduced. I finished training in August 2007. The first sitting of CSA was September 2007. And I had the choice to either submit another video or to sit the first ever CSA. And I thought, well, I'll sit the first ever CSA, because I might end up, again, taking a long time to get videos, patients. I don't have control of what consultations are there. And so I went and sat the first ever CSA. I passed every case, and I was awarded CSA and then overall MRCGP with merit. And having been through it myself, it's been really useful, because now when I teach CSA, I think it's really useful for registrars that I've actually sat in that chair and I've sat the exam, And so I can relate to some of the stresses that they had. But also, I think that, having had to do that preparation and then gone on to do really well, some of those skills I can, pass on and talk about the things that I found useful in preparing and on the day to get through consultations or deal with challenging cases or deal with a case where you might, have to deal with medical uncertainty and not know the diagnosis. I think that actually came to be a huge blessing because over the last 10 years now, I've helped thousands of doctors who are preparing for AKT CSA, but particularly for CSA, having been there and sat it and performed well myself, I think it's really useful then when I'm teaching others that it's not just the theory of this is what will make a good CSA case. I've actually been and sat in that chair, and that's been really, really helpful.
Right. That's very interesting. What was your self-talk when you were upset and you failed because of one mark?
But this is the thing is that sometimes, and I have a lot of registrars come to me, and sometimes that are recommended to come to me by their trainers or via the deanery, when they've failed AKT or CSA, either for the first time or often 2 or 3 times. And often, people are really upset because if you think those doctors that are in GP training, you've all worked really hard, gone through high school, university, often you were top of your school, got straight A's at GCSEs and A levels to get into medical school, done well in medical school, went through a competitive selection process to get into GP training. And for a lot of people, this might be the first big thing that they failed at. And it can be a huge shock to the system. And, sometimes people will be quite upset and they start doubting themselves. And that's really important because, especially for CSA, a big part of doing well in CSA, of course, you need to know your stuff. You need to be able to take good histories, to examine well, to communicate well, to manage your time. But you also need a lot of confidence in yourself. And I often see that if someone loses that confidence after doing poorly or just missing out by a few marks the first time, if they don't take the time to sort of really build that confidence up again and to look at their consulting and improve their consulting communication and knowledge, often if someone rushes to sit it again quickly because of that lack of confidence, when they have a case that doesn't go well early on in the exam, they start doubting themselves. And often you'll actually see a lot of candidates, their second attempt they do worse than the first, or they don't actually change that much. And then often, if they've taken longer before the third attempt, they start rebuilding their confidence and start, doing much better then. Okay. And so, one of the things is, yes, there was a time where I was thinking, in a way, it would be better if I fell by a lot. When you fell by 1 mark, you think, it's so close. But I think one of the things for me is that helped me is my faith in that, we have this thing in Islam that you do your best, and I felt I'd done my best. And once you do your best, after that, you leave your faith in God. That if something's not meant for you, the whole world can't give it to you. And, if something is meant for you, the whole world can't keep it from you, So, it wasn't meant for me. And, sometimes we want something and we don't get what we want, but what we get is something better. And I think that's what happened there, that, by having to sit CSA or having the opportunity to sit CSA, it's been so valuable. And it's allowed me to help so many people over the last 10 years plus of teaching CSA. Had I actually got that 1 extra mark and passed, I never would have been exposed to CSA in the same way. Yes, I could have gone to a course for trainers to learn about CSA, for example, but actually sitting it was such a valuable experience. I would have missed out on that. So I think that helped me a lot. And if there is anyone listening and you failed your exam or you didn't get the job that you wanted, don't worry about it. There's something better meant for you. There's something else meant for you, and it will come to you in its own time. Use it as a learning experience. Okay. We always have ups and downs in our life, and we will in our career. Okay. So use it as a learning experience, put it behind you. You've got fantastic skills, and maybe you just need a bit of guidance. Maybe you just need a bit longer to prepare, because sometimes things come up. Someone is actually working really hard, but then they're a little bit unwell, or their child is unwell just before their exams. And so, their final revision gets knocked off. Or sometimes you just have such a busy day at work. You'd plan to do some revision. When you come home, you're so tired, you fall asleep on the sofa and your plans are gone. These things happen. Okay. So put it behind you, and your time will come.
As a person in medical education who has seen a lot of registrars going through these exams, where do you see the candidates wasting most of the time?
Okay, that's a fantastic question, Irvin. So perhaps if I talk a little bit about maybe some of the common mistakes that might lead people to run into problems, and that might be a good way to approach that. So we'll talk about AKT and CSA separately, because actually there are some similarities in some of the mistakes that people make that are common, but there are also some big differences. So with AKT, I think one thing that I see some candidates do that perhaps isn't that productive is some candidates will pick a question bank, and there are lots of good question banks out there, and their approach to revision will be just to go through the same questions 4 or 5 times. And when you repeat the same question multiple times, the second time, the third time, the fourth time, there's not that much additional learning, because what sometimes happens is that you remember that question rather than having learnt the subject, and it can give a false sense of security. So I'll sometimes see someone who first time they were averaging 55%, then the second time they were on 60%, then the third time they were on 75%, then the fourth time they were on 85%, and they did it a fifth time and got 95%. Then they went to the exam and failed when the pass mark was 70%. And the reason for that is, the fifth time or the fourth time you're doing the same exact questions, you've just learnt the pattern. And sometimes a question that in the exam will take quite a long time, like a complex graph, and you've got to interpret it. You just remember the picture and you think, oh, it's B. And so you've done it in 15 seconds. But in the real exam, that question is going to take you, a full minute. But also, you've learnt that question rather than learning the subject. And often then they'll get it wrong in the real exam. So that's one thing I would recommend, is that, there's lots of good question banks, whichever one you pick. If you finish all of the questions, you're going to learn a lot more by moving on to a different set of questions, because now you're really testing, have I learnt the subject? Rather than just learning that question off by heart. If you're doing a different set of questions, then just repeating the same questions over and over again. So that's one thing. Another thing is that a lot of candidates don't have any systematic or structured approach to the curriculum when they're preparing for AKT. Instead, they'll just do lots of questions and hope that that'll be enough. And for some people it is, especially if they've already done a lot of different jobs and got a great base knowledge. But I see a lot of candidates that's not enough. And especially if they get a few questions early on from subjects they've never read or never touched, it can affect their confidence. Then when they get a question that maybe they have read, they doubt themselves, they'll change the right answer for the wrong one. And so one thing, again, I would advise is early on to get the curriculum checklist and to go through it and look at the things that you are least confident in and start with those. Do the things that you're bad at or that you don't like first, and then work through systematically. That way, you ideally try and cover the whole curriculum. But if you run out of time and there's one or two things you can't touch, it's better that they're things that you're already good at or you're already confident at, because you're probably going to still be able to get those questions correct in the exam. Okay, so that's one thing that I definitely recommend. And then for CSA, I think the biggest mistake is that some candidates just sit it too early. And when I mean too early, I mean too early for them. Everyone's ready at different points in their journey. People have different experiences before coming into GP. They have different experiences once they're in GP of their training program. They've got different jobs. They'll have trainers that are, more or less experienced in CSA. They'll have, VTS teaching that is, got a different focus in different places. They'll have a study group that is more or less supportive or more or less experienced. Everyone's experience is different, but sometimes people feel pressured to sit it early because some of their friends are sitting it early. And CSA is not an exam to sit for the sake of it or as a dry run. You want to sit this exam once and get through it. If you sit it when you're ready and you still don't get through, okay, these things happen. Sometimes people have a bad day and, okay, you might have to resit it. But what you don't want to do is rush, sit it once, fail by a couple of marks, knock your confidence, and then it can really have a big impact, on the second attempt. And then sometimes if someone has failed a third time, on their fourth time, they start getting really, really anxious because the exam nerves, they start, thinking about the bad experience they had previously. Whereas, if someone was more or less ready and it's the November sitting of the exam, can see that same candidate, if they delayed sitting it till January, they got a couple of months extra of consulting with real patients, of learning to manage time, of practicing in their study group, of getting the knowledge behind them. they're going to smash the exam. You don't want to be scraping through or just passing by one or two. If you're at that level where you don't feel really confident that you can smash it, it's better to delay by a couple of months. The exam's available monthly from October all the way to May. There's no rush. No one's ever going to ask you, when did you sit the CSA? So, I'd really advise people just to hold back until you really feel confident, delay by a couple of months, sit it later, sit it once, get through and clear by a good margin rather than rushing. Okay, because there's lots of downsides in rushing and just missing by 1 or 2 marks for CSA.
Great advice, Mahibur. I want to ask you now, what is your definition of success?
That's a fantastic question, Erwin. I think success is however you define it. And I think that's really personal to everyone. And I think that it's a really important thing that you don't let someone else define your success. So, for example, for one person, success might be that they've always wanted to be a partner after they finish their training. And when they finally, become a partner in a practice, for them, that's their definition of success. And that's fantastic. But for someone else, they might never be happy and never be interested in being a partner. And their success might be finding the right salaried role where they can really use their clinical knowledge and clinical skills and flourish in that role and do it to the best of their ability and be a fantastic doctor. But have the ability to not have to do additional work beyond that, not have to worry about, practice meeting about talking about the business or, staffing issues or, they're not interested in that. And that's their success, and that's fine. For someone else, success will be actually having a portfolio career where they can work as a part-time salaried or part-time locum and then do additional things that they're interested in. And they might not make a huge amount of money, but they're not interested in that. They've got enough to get by, but what they have is a lot of time to develop other pursuits. For someone else, success might be having time to spend with their kids, to play golf, to, pursue their hobbies, to travel the world. And they might only actually work 1 or 2 clinical sessions a week, and they're happy doing that. And so I think that's really important, that you define your own success and don't measure your success by what other people think. That as long as you're happy and you're doing what you're doing to a level that you are doing it to a good standard and that you're happy in yourself, that's success to me.
Awesome. I want to go now to a rapid fire question. Who is the most inspiring person you have met in your career?
So if I think about my career, I'd say, the most inspiring people are really not to do with people I've met in the job. It's actually my parents. And, my father loved studying, but my grandfather died when my father was 13. So he left school because the eldest, and he took a job at 13 to support his brothers, sisters, my grandmother, and similarly my mother, throughout my whole life, how much they both supported me. That I come from humble means. We didn't have a lot of money when we were growing up, but one thing both our parents said was, if it's to do with our education, that we could have whatever we needed. We were one of the first families in our road to get a computer, even though we weren't wealthy. We didn't have a lot of other things, but they sort of recognized that this is going to have a huge impact going forward. And it did. And this really where I first got involved and interested in informatics, if you like. It's from that young age. Similarly, my brother then went on to work in technology. He's a teacher now. And they instilled that passion of education and of learning at a very young age. And, they said that it doesn't matter what you do, just try to be the best at it that you can be. And that, don't settle for good. Just keep pushing for excellence. And I think that's stuck with me and helped me in all the things I've done. So I'd say, I think that they really have been fantastically inspiring throughout the whole journey.
Okay, thanks for sharing that. What is your motto in life?
Really goes back to that thing about pursuing excellence. I think, it doesn't matter what you do. Try just to do it to the best of your ability. So whether that's, playing with your kids, really get into it. Whether that's, doing something that you're interested in as a hobby, try to really give it time and effort, and enjoy it. Whether that's in my work, try to do it to the best of your ability. Whether that's when you engage with a patient, really giving them your full attention. That whatever you do, just try to give it your full attention and try to do it to the best of your ability.
I can relate with that. I think you have a satisfaction when you do something to the best that you can. It doesn't matter if you fail, but if you've done everything you could, then you know at least that you've given it your best shot.
Absolutely, yeah. I think it's not the outcome that's important. It's nice to have a good outcome, but yeah, it doesn't matter as long as you've given it your best. That I think that's the key.
Is there anything you want our listeners to do after listening to this podcast? Any advice or any call to action?
Yeah. So really, what I would say is that for those of you that are in training, I would say that if you plan your study, be prepared. MRCGP, they're challenging exams, but they're fair exams. So they're challenging. They have a significant fail rate, both AKT and CSA. And I think sometimes when doctors don't realize how much time is needed, they underestimate it. That's when they get sort of into a bit of trouble. So plan ahead, be prepared, put the work in. If you do need any help or any advice, if you're preparing for your first attempt and you want to know what to do, you're not sure where to start, or if you have been unfortunate and you missed getting through an exam by a few marks or many marks, if you want any guidance or advice, feel free to email me or contact me. You can get hold of my contact details from the website emedica.co.uk. Whether you've been to any of our courses or not, I'm always happy to offer free advice, support to anyone. For those of you that are coming to the end of your training, I'd say, look at what you want to do, define your own success, be open to opportunities that are out there. And you might find that, different things pop up into your portfolio over the years. Okay. And there might be some people listening that aren't medical. I think some of those same things stand true, that, we'll all have some ups and downs in our life. You might fail to get a job at an interview. You might fail a professional exam. Don't worry about it. Learn from it. Look at what you could do to improve. Use it as a opportunity rather than seeing it as a problem. And then you'll be even stronger and better for it the next time. And then finally, that whatever you do, do it to the best of your ability, and then you will be successful because you're defining your own success.
Thank you. Thank you very much, Mahibur, for being on the show. Where can people find you?
Yeah, thank you very much, Erwin, for inviting me. It's been really nice speaking with you. So people can connect with me on LinkedIn. Just look up my name. So the spelling is Mahibur for the first name. Surname is Rahman. All of our courses and information about the things that we do are on the website, which is www.emedica.co.uk. And then we've got our Facebook group for anyone interested in GP training, which is GP Training Support. There are over 11,000 people on there, either all applying or in training. And there's also a lot of trainers and educators. Everything's free on there, but there's a really friendly, supportive bunch of people. So if you're interested at all in GP training, do join that group. And I'm on there regularly. If you ask questions, if I can't answer it, one of the other 11,000 people in the group will answer it. But you can also contact me by email, info@emedica.co.uk. So, whichever way, I love to meet people interested and passionate about GP training, whether you're applying, whether you're in training, or whether you're qualified. So do get in touch. If you've got any questions, any queries, anything at all, always happy to meet new people.
Thank you for listening. If you enjoyed this episode, I would be incredibly grateful if you could please help me to get the word out there by sharing it with someone you think will benefit from listening to this conversation. If you have not already subscribed, please subscribe to this channel so you don't miss on the latest episode.